The gentleman from Rhode Island is recognized.
Thank you, Mr. Chairman. I thank the chairman and the ranking member for this bipartisan en bloc amendment and rise in support of my amendment that would better ensure that we meet the urgent mental health needs and addiction treatment needs of military personnel returning from Afghanistan. After more than a decade of war, many of our heroes are returning home from several tours of duty in Afghanistan and Iraq. To honor their service, we have the responsibility of ensuring that we develop treatments to address the specific health needs of our returning veterans. This year, as our troops return home to their families and loved ones, Congress should be increasing investments in the research that will help us better understand how to provide these veterans with the care they need and deserve. Early indications and analysis suggest the need to focus our efforts on psychological health and substance abuse. Importantly, in many cases, our returning veterans suffer from both mental health and substance abuse disorders simultaneously. Delivering health care to these patients is exceedingly difficult, but it's our responsibility to address this critical health need among our nation's heroes. And I want to compliment the chairman and the ranking member because this legislation contains important investments in peer-reviewed traumatic brain injury and psychological health research programs. But I believe that we have the means and the ability to do more. As this health need grows more acute and as more veterans return home, we should be increasing these investments. That's why this amendment would increase funding for psychological health research by $13 million and substance abuse research by $1 million. To pay for these increases, my amendment would slightly reduce the increase in funding for the Afghanistan Security Forces Fund by $60 million, a modest decrease of a total allocation of $7.7 billion. My amendment would shift a small fraction of this increased funding, reducing the total allocation by less than 1%, in order to provide a small increase in funding for critical health research for our veterans and returning military personnel here at home. I thank the ranking member and the chairman for including this en bloc amendment, and I yield back.
I apologize to the gentleman. I knew his state was on water, and I would yield back my time.
The gentleman yields back his time. Is the gentleman from Arkansas claiming announced?